And the beat goes on. We continue in day 11 or 12 of the coronavirus issue. Staying together, staying away, staying in a house, avoiding certain things, all the things that we're supposed to be doing. So continue to stay safe. Look at some of the past shows that we've done on our Facebook page and on our YouTube page about prevention. Just reviewed with a young lady in West Virginia about the use of proteolytic enzymes, breaking that protein matrix around the coronavirus, finding that to be interesting. And the fact that there was a little report that came out about a couple of the doctors in New York treating patients in the hospital using intravenous vitamin C. Love the idea. Problem is, can't really get any vitamin C right now. It's dried up, just like a lot of things have. So we continue to forge ahead, stay safe, practice the right things, and continue to pray about it. Today we're going to talk a little bit about blood pressure. You know, it's a big issue with doctors, cardiovascular issues. The silent killer, you might want to say, that we really don't recognize a lot of times, that our blood pressure is up until it's too high, and then we start getting headaches or we don't feel right. And we end up going to the doctors, and there's a whole myriad of different medications that have been used. And over the years, there's been first generation, second generation, third, there's a myriad of those. And then we talked inhibitors, one of those classes being at a higher risk factor. So what's one to do? And on the natural front, from hawthorn to magnesium, etc., I take a lot of magnesium myself to keep my pressure in line. But what about on the other end of the spectrum? Doctors for years have said, if you have low blood pressure, hallelujah, God bless you, you're in a better place. University of Exeter, and the reason I'm bringing this up, just for you who may be one of the ones that are out there, and your blood pressure is always low. I'm like 100/60. And your doctor says that's fabulous, that's great. And I've actually heard this comment from a lot of doctors that said, how do I know if my blood pressure is too low? And the doctor would say, well, you'd know, you'd pass out. So if you're not passing out, it's not too low. Listen to this. New research has found a link between low blood pressure and high mortality rates. A large-scale study led by the University of Exeter, published in the Journal of Age and Aging. Don't want that, no. Analyzed 415,000 electronic medical records of older adults in England. The research was conducted after some countries have changed blood pressure guidelines to encourage clinicians to take measures to reduce blood pressure in a bid to improve health outcomes. Big push. Put everybody on a blood pressure med. UK blood pressure guidelines are within safe parameters for all, they said. However, previous research has not considered the impact on frail older adults that are often omitted from the trials. Elderly whose pressures are just obviously low all the time. The team found that people aged 75 or older with low blood pressure, that's below 130/80. That was never really considered that low. But in the elderly, those with low blood pressure below 130/80 had increased mortality rates in the follow-up compared to those with normal blood pressure. Well, if 130/80 is considered low, what's normal for this group? It says this was especially pronounced in frail individuals who had a 62% increased risk of death during the 10 years of follow-up. Although high blood pressure increased the risk of cardiovascular incidents, such as heart attacks, it was not linked to higher mortality in frail adults over the age of 75. So there really wasn't a problem in individuals over the age of 75 that had hypertension. Older people aged 85 and older who had raised blood pressure actually had reduced mortality rates. Can I read it to you again? Patients over 85 who had raised blood pressure actually had reduced mortality rates. I had a cardiologist that agrees with that. This was regardless of whether they were frail or not. Should there be something in medicine that says, hey, past the age 75, stop the meds? Stop it. Jane Masoli, a geriatrician, works with geriatric populations, and a doctoral research fellow who led the study as part of her PhD at the University of Exeter, said, internationally, guidelines are moving toward tight blood pressure targets. But our findings indicate this may not be appropriate in older individuals. We need more research to ascertain whether aggressive blood pressure control is safe for older adults, and then for which patient groups there may be a benefit, so we can move toward more personalized blood pressure management in older adults. She added, we know that treating blood pressure prevents strokes and heart attacks, but we would not advise anyone to stop taking their medication unless guided by their doctor. So this is actually an article, a scientific research that it's addressed to your doctor. Continue to monitor your patients. Now, we may be talking about you checking things out with your grandma, grandpa, mom, dad, maybe it's you. Check out your pressure. And if you're falling below 130/80, you may want to have a discussion with your doctor or your cardiologist. If you're over 75, because we want you around as long as we can. In this article in particular, a little frightening in a way to say that low blood pressure actually was a higher risk than high blood pressure. Intriguing. Hey, any other questions? We're still trying to do our part here during the coronavirus. Still offering 50% off our consult price over the next week. Call and get in now. We're going to do this till the end of the month. So if you have any kind of issues, please give us a call, 678-228-8900, 678-228-8900, or go to our website, thenutritionshop.net. We'll be glad to help. You can schedule your own personal consult right there. So God bless you, folks. Anything else you need, please give us a call or visit us on the web, and we will see you back here tomorrow where we'll talk about curcumin, turmeric, the spice of life. We'll talk about that tomorrow. Make sure you tune in. Take care.